just ahead on the Smart Life.
Okay, so you love to eat, I get it, but you also want to stay healthy. Now I really get it. Well, our experts are going to show us how to add a little bit of low-cal there, right?
Absolutely.
Low-cal, but still lots of flavor.
Then the other half of the healthy equation, exercise. We'll show you how to easily incorporate exercise into your daily routine.
Then we're going to hear from an expert about how women can identify their risk for breast cancer.
And compare facial fillers to face and neck creams.
All that and much more next on The Smart Life. Hi everyone, I'm Olga Villaverde.
And I'm Derek Latta. We're here to talk about understanding your risk for breast cancer.
And joining us to understand all this is Dr. Alex Zuriarrain, a plastic surgeon at Baptist Health, South Florida. Welcome to Smart Life, Doctor.
Thank you both.
Really do appreciate it. I know we're going to talk about breast reconstruction and we have a lot of things to cover, but I want to focus on breast cancer risk. What is the best indicator today?
The best indicator for breast cancer risk is called the Gale Model Risk Assessment Tool.
And what is that?
It's a tool that anybody can use. That can go online and they can actually plug in a lot of their own data.
Really?
Their age, if they've had children or not, how old were they when they started menstruating, when they had menopause, all of this, some of the factors that are very, very important. It'll actually give you a general idea. And of course, data is good, but in the wrong hands, it can get a little bit confusing and kind of scary. So you're always recommended go see your primary care physician or your oncologist to really get a good grasp. You have to take into account your risk factors. So if your mom had breast cancer under the age of 50, for example, you're gonna wanna start getting screened much earlier. But those are really, really detailed conversations you need to have with your doctor.
Absolutely. How does that, being high risk, how does that change someone's life? I'm sure right away it's a shock. Anything else that would?
I guess you start thinking differently,
You
right?
start thinking differently, and you start focusing in on it, and it can cause a lot of anxiety. It can cause a lot of psychological disturbances, paranoia sometimes. So again, your conversation with an actual physician who specializes in this type of care is very important.
All right, so let's say, I know you do a lot of reconstructive breasts.
Sure.
What is the population, would you say, of who you see? Do you just do more cosmetic for just women who want to, whatever, enhance or decrease? Or do you do a lot of women who come in after a breast cancer diagnosis and then they need to see?
Correct. Yeah, I have a mixed practice.
You have a mixed practice.
Yeah, so I try to serve the population of patients that are interested in breast reconstruction. These are typically older patients that have had mastectomies or lumpectomies. And then I also serve a population of patients that are interested in basically looking the best version of themselves. They're looking to enhance or, like you said, reduce certain aspects of their body, either through liposuction or other means.
But it's one thing to do cosmetic because you're looking forward, you want to do something, you're looking in the mirror and you want to, just whatever, improve or whatever, do whatever you want. It's another thing when you have a diagnosis. Can you share with us, and I'm sure you've had a lot of patients, but maybe a couple personal stories of women who have come to you and truly have had a difficult journey where someone like you helped?
Yeah, absolutely. I had a 38-year-old woman, young woman, Caucasian. Yeah, and she actually had a BRCA risk, and she had her bilateral mastectomies done.
She chose that.
She chose that option. She had a very strong support network, though. She had a husband, she had about 3 children, and she decided to make that leap.
When she came to you, did she ask for your opinion at the last second? Am I doing the right thing?
Right.
Am I crazy?
Should I do this?
What the typical progression in United States medicine nowadays is that she will have started with her primary care. She would have then gone to a geneticist or an oncologist, and she would have had all those conversations with them. Then she would have seen a breast surgeon. The breast surgeon would have performed the procedure, and then finally she comes to me for her reconstructive option. So I really don't ever get a chance to see them before they have their mastectomy. It happens, but it's not common.
And when that patient comes in, like that 38-year-old who opted to do it, and I completely understand why she did it, especially when you have children as well. I think that's a big factor that makes you say, I'm doing this. But do you explain to them just the emotional toll, the spiritual toll, the fact that they're not going to have sensation? It's a lot of stuff.
It's a lot of stuff. And the more you educate them, the better the results are in terms of their psychiatric well-being. So it's a lot of questions that they need answered, and the longer you spend with them in consultation, the better the results.
How have the surgeries themselves improved throughout the years?
Yeah, there's been dramatic
You
improvements.
used to have scars from here to here.
Absolutely.
Okay.
The scars have gotten smaller. We're sparing the nipple a lot of times. We're sparing the areola.
That's a great point. You can spare the nipple when it's by choice.
You can. It's an option. It's an option. But you have to calculate your risk factors.
Because you can still develop something there, but it is an option.
It's an option. It's an option, absolutely. And microsurgery has come a long way. We use very, very high definition microscopes with some fantastic technology that has come around to do these transfers of tissue, autologous or your own body tissue, to different parts of the body.
And the scars are pretty minimal, I think.
I was going to ask you that.
Right?
I was going to ask you, I said, excuse my ignorance, but you would go in again through the scars that existed from when they removed?
Correct. Yes, we use their existing scars. We don't make any new scars.
Okay.
And if we're using their own body tissue, for example, their abdominal excess, we do what's called basically a tummy tuck type incision, okay, very low along the bikini line. We can use that tissue and we can transfer it microsurgically to the chest and recreate a breast mound, eventually a nipple, eventually an areola, and it all goes forward.
And what's fantastic, even with scars today, now there are lasers that can actually help remove the scars where you don't see anything at all.
Yes, it helps decrease the scar, density.
And to end on a positive note, I'm sure they're excited to see you because they just want to look better and get this thing going.
Yes,
They already went through
yes.
the difficult part. Now it's like, come on, I want to look good.
And
I wanna
move on.
Feel good.
Yeah,
And let's go.
And I'll be honest with you, that's what's most gratifying to me, and that's what makes me happy. When they come in to see me, I know that it's, they've gone through a difficult time, but now I'm going to help them and move on to a very happy part, which is restoring, form and function.
I see you like that book, and you get to the last chapter, and the chapter ends fantastically, and you go like that, you close the book, you put it away, and you say, ja, se acabó.
Exactly. You're driving home from Disney and one couple miles left. Okay, here it is.
That's
I'm
it.
already.
Yeah.
Thank you so much. Thank you for
so
what
much.
you
Thank you,
do.
doctor. Appreciate it. Thank you for your help.
Thank you very much.
More Smart Life after this.
Jeff Nelson suspected he'd get prostate cancer since his brother, uncle, and 2 cousins had it. But when he was diagnosed, he chose the newest technology that treats only the cancer, no healthy tissue.
If it wasn't for the catheter, I swear, walking out of that hospital that day, I felt pretty much normal.
His cancer was just in this focused area right here.
Dr. Edward Uccio at UC Irvine is pioneering the use of the Focal One high-intensity focused ultrasound, or HIFU. It was appropriate for Jeff because his cancer was detected early and localized to one area of the prostate.
Because we know that it could be in one side, just one area of the prostate, we can actually treat focally just in that area.
First, Dr. Uccio uses a specialized MRI system that gives him a 3D image of the cancer. He uses that to precisely target the treatment area,
where you can actually focus ultrasound waves and heat up the cancer and actually kill the cancer within the prostate.
Jeff's PSA level dropped from 7.3 to 6.1 after the procedure, and he's hoping it goes even lower. He's telling his friends about HIFU and urging them to get checked.
If you address it early, you can go through a simple procedure like I've gone through, and it's nothing.
You notice a big difference with it.
And nothing is what he hopes Dr. Uccio finds when he returns for a checkup biopsy in a few months. I'm Marty Salt reporting.
More Smart Life after this.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at AllHealthTV on Facebook, Instagram, and Twitter.